Hi, this is Dr. Dave Scheider, Director of Education, Integrative Psychiatry, Sarasota, Florida. Today, a few words about depression. Depression is common, costly, and catastrophic. Common, it is the most common psychiatric illness, and in primary care settings in adults over the age of 45, and I'll bet you didn't know this, it's actually the most common illness we see, period. More common than heart disease, diabetes, metabolic syndrome, hypertension, arthritis, asthma, GI complaints. It's also very costly. Depression is a major contribution to disability worldwide. More days are missed from work in the United States due to depression than any other single illness, and depression costs American employers up to $44 billion a year. Most of those costs are not associated with direct treatments. It's not your medicine, it's not your supplements, it's not your lifestyle modification, but rather it's the consequences of inadequate treatment that are driving these staggering costs. Lastly, depression is catastrophic. Well, what do you mean? Well, depression rots your brain. It shrinks your neurons. It kills your glial cells. Glial cells make up 90% of your brain matter, although neurons get all the publicity. Depression is pretty toxic to the brain if it goes on unabated for any length of time. Perhaps worse than that, however, is that depression is a systemic illness. It does not just affect your brain, but rather is exported to the body, if it didn't start there in the first place, more on that later, such that if you have depression, you're twice as likely to get diabetes, you're twice as likely to get Alzheimer's, you're more likely to have a heart attack, and much more likely to die of that heart attack. Women over the age of 65, the degree to which they have bone mineral density loss correlates with the severity of their depressive symptoms. If that's not bad enough, depression can kill you on average 10 to 12 years before your time. This rivals the premature death rates we see with smoking cigarettes and cancers across the board. It is for this reason that we take the treatment of depression so seriously. Most of my professional time, indeed, is spent diagnosing and treating depression in patients and consulting clients. When I'm not doing that, I'm out preaching the good word to other clinicians, physicians, chiropractors, naturopathic doctors, physician assistants, nurse practitioners, medical students, residents, nurses, psychologists, therapists, anybody that'll listen, even people that won't listen, and you may have zoned out by now, but tough. I'm going to continue relentlessly to try to inform you and my colleagues as well. We also offer a wide portfolio of services. We practice conventional, traditional Western allopathic psychiatry, but we also practice alternative and complementary psychiatry. So we are able to speak multiple professional languages. The reason we have done that is so that we can help more people. So whether you want the traditional approach with medication, the psychotherapies, again, big believers in those, or whether you want to try lifestyle modification or nutrition or supplements or what have you, we feel prepared to meet you where you're at and help improve the quality of your lives, particularly as pertains treating depression, and maybe even eventually help you pursue happiness more effectively. With that in mind, we'd love to hear from you, so give us a call. Let's see, 1-800-385-7863. That's 1-800-385-7863. I sound like I should be doing the junior sample BR549 maybe from your hee-haw days, but anyhow, that's not our number. Don't call that. 1-800-385-7863, or email us at info@integrativepsychiatry.net. Either case, you can ask for me by name, Dr. Dave, or just any one of our staff, and we would love to hear from you. Love to know what's on your mind. Love to know how we can continue to customize our portfolio of goods and services to better meet your needs. Until then, this is Dr. Dave signing off. Talk to you soon.